and you exit through a different door, it's going to change your perspective of that same area.
Okay.
So the nose is a small part of our anatomy.
Yes.
And you all of a sudden see it from a different perspective.
Ladies and gentlemen, welcome to another episode of the Rhinoplasty podcast with me, Dr. Cameron McIntosh. And in season 3, we are doing face-to-face interviews. And I am in Brussels, right here under a painting of King Leopold in the academies, right in the center of Brussels at the European Rhinoplasty course. And one of the other faculty members is a great friend and colleague of mine who's been on the Rhinoplasty podcast a few times. But I thought it's such a nice opportunity to sit and chat to Professor Dr. Philio Lekakis again. Philio, welcome.
My honor. Thank you so much. It's really exciting that we are doing this face-to-face, isn't it?
It's been much too long since, we saw each other in South Africa. We've seen each other all over Europe, and it's just lovely to meet up again. So tell me about this new role that you've been playing as a director or something at the EIFFPS. What is the EIFFPS? Tell us about it, because remember, this is a podcast listened to around the world, and people don't always know this. So tell me a little bit more.
Yeah, so European Academy of Facial Plastic Surgery is really an academy that's been growing the last few years immensely. We have now 1,400 members registered. It used to be the old Joseph Society. So it's very much an alive body that grows, and we welcome surgeons, facial plastic surgeons from all over the world. Predominantly from Europe and countries like Israel or countries from the eastern part of Europe. And yeah, I have been the director of the fellowship committee for just over a year now. Essentially, I look after people that want to take up on a fellowship.
Yes.
And follow a more formalized training to learn principles of facial plastic surgery and develop skills in that area.
And I mean, your own training was through a fellowship authorized under EIFFPS.
That's right. That's right.
Yeah.
In the UK, once I completed training as an otolaryngologist, ENT surgeon, we were actually encouraged towards developing of special interest. And this is because subspecialization was vital in that part of the world. So I had the opportunity really and the blessing to become a fellow of this academy 12 years ago. And I spent a year abroad outside the UK. I was in the Netherlands and I was also in California. And following that period of time, I had to do the board exam. Which at the time was in Washington. We didn't have the luxury of having a European-based exam, which is now the case, because now you can just go to London and do it. Although I think they're moving it to Germany. But anyhow, it's Europe-based
instead of going to the States.
Easier for European fellows.
Easier to get there, but not easier to write, because I've had to go down that route as well. Yeah. Okay, so Philio, let's park this EIFFPS thing. The stuff I really want to climb into, there are two things. The one is, how have you, because I think there's kind of a similarity in our journey over the last couple of years of integrating preservation principles into our rhinoplasty practice. Now, as somebody who is got a PhD, who thinks scientifically and is passionate about rhinoplasty, how have you managed to integrate this into your practice?
I think really it very much depends on your appreciation of your journey towards excellence. And if you're really interested in something like that, it's very difficult to ignore preservation rhinoplasty.
Yes.
Not only because it's something that's growing by the day, but...
Is that growing or is that regrowing?
Well, absolutely, you're right. If we look at the history, this started with Godel in 1899. So imagine that end of 19th century, this idea comes up, which was continued in the beginning of the 20th century. We have Maurice Cottle and Lothrop that in 1954 and 1917 respectively. But for whatever reason, the idea didn't take off so much in the 20th century in Europe. However, in the South America, you will find great surgeons there that continued in that technique, and this technique remained very much alive. And I think, given the globalization that we all experience, we still, as a surgeons need to have a global perspective, because that will definitely bring down barriers and will facilitate the process towards excellence. So when I was first became aware of preservation rhinoplasty principles and what you can achieve via Yves Saban, who's of course the guy that was popularized this in Europe for us, I was astonished. I immediately thought I need to throw myself into this. And we all like the challenge being involved in this field, there's no doubt. And I'll tell you something that maybe sounds provocative, but I don't think it really is. Learning preservation rhinoplasty will make you a better structural rhinoplasty surgeon. The simple example I can give is that, let's say you have a room and you enter in this room via, the door, and you exit via another door.
Yes.
And you do this every single day.
Yes.
But all of a sudden, you open a different door to that room and you exit through a different door. It's going to change your perspective of that same area. Okay. So the nose is a small part of our anatomy.
Yes.
And you all of a sudden see it from a different perspective.
Yes.
Simply because when you are learning and you are trained, me included, as a structural rhinoplasty surgeon, you are told, no, you can't go to this area. It's a sacred area. You touch it.
Yeah.
And all of a sudden, you have to touch it. You have to manipulate it.
Yes.
But then you see that your results can go even higher. So it's really difficult to not go into that challenge as far as I'm concerned. And really, when you learn a new technique, you never stop being good at what you were at already in the first place. In fact, we talk about preservation as if it's, the new thing, but the new thing is not even preservation, it's the hybrid rhinoplasty that we all talk about. What does that mean? Simply by combining the principles of both worlds, you can get your results even further. And this is what it's all about. I think actually being a surgeon is a very egoistic thing. And, I don't operate...
Do you really think it's egoistic?
It's very egoistic. And as far as I'm concerned, of course I care about my patients. Of course I'll do, the maximum for them. But I don't really operate for them. I operate for me. It's me that I am the most severe critic to my results. It's me that I say, come back at a month, come back at 3, at 6, at 1 year, once a year after that. I actually phone them. I chase them up for the control appointment. 3 years after the surgery, why this is the doctor calling me? It's important for me. It's the only way that will contribute to my self-development. So this is an egoistic approach. I believe that. But it's for the better. It's the only way I can become a better surgeon.
But it's not, this is the interesting thing with words and understanding. It's not in arrogance. There's a humility in that. Because to be able to be so fanatical about criticizing yourself about your work, but there's also realizing actually, wow, how could I have improved that? And accepting that, which is wonderful.
Absolutely. There's a certain part of obsession in there. But I think it's very nice if your personality trait, whatever that is, combines with your work. This is the joy. This elates you. I'm elated when I operate. I don't think about anything else.
Yes.
So it's if you can feel that, it's humbling and it's privileged as well.
I've been listening to some other audiobooks and stuff about getting into that zone of that utter focus and stillness when you're operating. And so I think that's something that's not spoken about enough, is the mental preparation in rhinoplasty. I'm something I'm going to think about a bit more. But this is another topic I want to chat to you about, and I think there's not enough spoken about this, is the nasal, I'm hesitant to use pathology because it's got a bad connotation, but nasal disease, someone who's got allergic rhinitis or someone who's got nasal polyps. we come to these conferences and people talk about all the techniques and blah, blah, blah. But what about actually medically managing rhinoplasty at the same time? And if a patient doesn't breathe well and they come for the rhinoplasty, still not breathing well, tell me a bit about what your thinking is around that.
Yeah, I mean, the nose is the most, if you like, it's the central part of the face, the part of the anatomy that is so important because it's in the middle of the face and always seen. But at the same time is, you breathe through the nose. It's actually your nose is, I tend to explain to patients simply, is the slave of your lungs. It needs always to humidify, clean, and prepare the air that goes down. So all sorts of, if you like, poor quality of life can be associated to bad breathing out there. So you have to be, as a rhinoplasty specialist and as a rhinoplasty expert, you have to be able to manage this part, this functional role of the nose. And by that I mean, aside the polyps, I don't deal with this part of the nasal pathology, but if I diagnose an allergy, I will absolutely explicitly emphasize to the patient that I don't operate your allergy, and your allergy will not leave you after the surgery. These are simple concepts, because sometimes patients can come even with higher expectations in breathing. And I will actually, as a matter of fact, make this nose of yours, who's allergic, smaller. So please, of course, you do your best to preserve functionality, improve functionality in cases you have deviation, in cases you have a collapse, in cases you have small anatomical areas such as the nasal valve, which is so important. But in case you have a concha bullosa and an axis deviation, there are so many things that you need to address. But one thing is for sure, that, being a dedicated rhinoplasty surgeon, you need to be able to address functionality as well as aesthetics at the same time.
Yeah. Yes, that's great. So, Philio, the last thing I want to chat about, and it's sometimes something that I feel like, why am I even chatting about it? But it's the role that you as Philio Lekakis play in this like male-dominated world of rhinoplasty. And like, I've known you for many years now, and I think you're just a wonderful human being. But what frustrates me, and I think the thing about it is that you are really an example to a lot of women out there. But surely there must be times where it's tough, it's hard doing the kind of stuff that you're doing. So yeah, in a way, it's almost like being a bit vulnerable. How's it going with you in that aspect? And what would your advice be to the ladies out there? Because, I mean, I remember chatting to Roxana Kobo in season 1 of the podcast, and she was telling them a horrific story of her first international congress, and she was at the faculty dinner, and this man next to her says to her, "What are you doing?" And she says she's on faculty, and he says to her, "No, but you should be in the kitchen with your children." And I just thought that was just so disrespectful and crazy. But like, I'm a male, so I'm not facing that kind of stuff. I've got other obstacles to have to overcome. So coming back to the question is what is your advice for the ladies out there? Because they're like, even on the course here, there are a lot of women who have come and they're doing the cadaver dissections and they're operating, which is absolutely great. And it's so inspiring.
Yeah, I think unfortunately stereotypes are in our DNA and in our pop culture, so it's very difficult to get rid of them. And I think what I would certainly encourage women, if I can do it, they can do it. I'm very happy when I see women in courses. As a fellowship director now, I'm not biased in favor of women, but I so much enjoy when I see women coming forward, applying, wanting to become fellows, and I see this motivation, which is excellent. I truly believe women can excel in this field.
Yes.
We have all capacity.
Yes.
But it's a matter sometimes of consistency. It's a matter of overcoming all these frustrations that you talk about, that it can be time consuming and also, a little bit of psyche consuming. You just have to keep doing what you're doing, keep focusing, don't deviate, don't let that drain you, because at the end of the day, your career doesn't depend on the opinion of your colleagues. I have received so much criticism from right, left, and center, and often uninvited. Be very wary of those.
Really?
Your career depends on the appreciation of your patients towards your work. And it took me a while actually to get to that conclusion. So I think my biggest joy, as getting that position at the European Academy is to inspire. And I really hope that other women will see that and envisage themselves in this position and be bold enough to come forward, because it takes a little bit of courage, since this world is so male dominated.
Yes.
But all competitive professions have a little bit of a more of a male edge, or, we can say. So it's about time to break some ceilings, isn't it?
That's it. I love it. Philio, that's great, man. It's so nice to have you on the podcast again.
Thank you.
I think we have to roll and go and do some more lecturing. So thank you very much. And
Thank you.
Listen, I've got so much respect for how you are managing the family and your practice and EIFFPS and everything, and still remaining bubbly, Philio. It's great.
It's doable. Thank you.
Awesome. Guys, thank you so much for listening again, and we'll see you guys next time.